So, thank you everyone this evening for joining us. Wow, what a pleasure. So, our topic this evening for our sip and chat is back to school. Some updates on how schools are moving forward. I know some districts have different options, etc. And we're also going to have some great questions for Dr. Barone. So very quickly, I'm going to introduce everyone this evening. So again, my name is Deborah, COO for American Caribbean Chamber of Commerce here in Houston, Texas. We are Fort Bend focused, and we have a global reach, and we're here to help. So our commentators this evening will be Constance Jones. She is our outreach director. We also have Ty Jones. She is our communications director. And we have Kirby Williams of Kirby Productions. She's very special to us. She's very creative, and she makes us look good. So that being said, the three speakers we have on this evening, we have State Representative, House District 27, Ron Reynolds. We also have Dr. Joseph Barone. He is a pulmonary specialist. And we have Addie Highlander. She is Board of Trustees and VP of Fort Bend ISD. So thank you very much for your participation and your patience. I will lend the program over. Thank you.
Thank you so much, Deborah. Excited about this conversation we're about to have. Get some answers from, very important people that are on this call, especially, Dr. Joseph, Addie, and State Representative Ron Reynolds. So we're going to go ahead and get started. We definitely want to start with Dr. Joseph Baron. I know he has limited time, and we'll get started from there. And the first question is, it's a question everybody is asking, the basic question of what is COVID-19, and could you compare it to the flu? Like, most people are comparing it to the flu and saying it's, just a little bit more advanced. So what could you explain to us about it?
The easy way to explain what COVID is basically to tell you it's the worst nightmare I've ever had. I mean, simple as that. It is a catastrophic illness that has the potential of killing a lot of people. It's not a hoax. It's a real thing. It's an illness that is caused by a virus that is part of the coronavirus family. It's not something that we have not seen. I mean, coronaviruses have been around for a long period of time. However, in the last 20 years, we have seen 3 giant outbreaks of coronavirus. Most of us, that don't travel too much, are not too familiar with some of these others. But for example, in Singapore, in the year 2003, there was a gigantic outbreak of a coronavirus-like agent that was called the SARS epidemic. I had the opportunity to fly there and actually learn how they were doing, their techniques of isolating patients, and it was fascinating. Then years later, we had what was called as the Middle Eastern respiratory syndrome, the MERS, which is another kind of coronavirus. So coronavirus is not new. We are now dealing with a kind of a cousin or a short cousin of the coronavirus family that is very aggressive. It's not just the flu, because yes, the flu kills you, and the flu, there are a lot of people that die, but the way by which the coronavirus works, it is fascinating. Coronavirus kills you by 2 mechanisms. Mechanism number 1, a lot of inflammation in your system. Mechanism number 2, a lot of clotting in your system. That is very unique to this virus. And this virus will stab you in the back, because every day I see a new presentation of this catastrophic illness. It's not just the little cough and fever and chills that everybody gets concerned about. I mean, we see people show up with clots. We see people show up with strokes. We see people show up with heart attacks. I saw a guy that came into the emergency department a few weeks ago that basically was dead on arrival. And when we did an ultrasound of his heart, he had clots in all chambers of his heart. So this is not oh, it's not going to happen to me kind of thing.
Wow. Okay. And my next question is, so the mask that we are wearing that is required to wear, in public, is the mask helping protect from the virus, or should we be wearing the N95 or N99 mask?
Well, first of all, the reason why you wear a mask is not to protect you. When I wear a mask, I do so to protect the other person. I don't do it to protect myself. That is what I call social conscience. People need to be educated. Educated in the sense that if I'm wearing a mask, I am doing to protect you, not to protect me. If I'm wearing the mask and you're not wearing the mask, might as well not wear a mask because it's completely worthless to use it. The only way by which a mask works is if both people have the mask. As far as what mask you should be getting is a mask that will cover your entire face. A mask that it's complete. I mean, I like orange, so mine is in orange. But a mask that can cover your nose and your mouth. It's not gonna take away your oxygen. It's not gonna get you in trouble. It's none of those things. The N95s, they are very nice. They are fancy. If you work with a patient that has COVID-19, like we do, it's nice to use. But by no means, an N95 is going to protect you if the other person is not wearing a mask. And that's the most important part. If you want to educate the public, if you want to educate those people around you, you need to make sure that they understand that your first responsibility as an individual is to not to protect yourself, to protect the others. Because people say, oh, it's my right not to use a mask. Yeah, it's your right not to use a mask, but the way I look at it is you can actually kill somebody. If you are symptomatic, you can kill somebody. Just to give you an example, we have actually tested close to 140,000 people in the Houston metropolitan area. Of those 140,000 people that we have tested, about 20% of them are positive for COVID. Of the ones that have COVID, those 20%, 48% of them don't have any symptoms. That basically means that up to 50% of people, close to half of the people that are out there with COVID positive, they are completely asymptomatic. That is very scary. I find that very, the way I tell people is, I feel more comfortable being in my COVID unit where I know who has COVID than being outside where I have no idea of who has COVID and who doesn't. So because I don't know who has it and who doesn't, I would say, let's go ahead and wear our mask. That is going to protect the other person, it's going to protect you. If you both have it, if you both have the mask on you, your chances of being infected are less than 1%.
Okay, and then to come to my next question, can you become reinfected after you have COVID?
That's a very good question, and I was on the news on this a couple of times this week, once on CNN and once on KPRC. And the answer is, I say yes, because I have had several patients that come back with COVID again. Now, the biggest question that we have as scientists is this the same COVID that I had, 2 months ago, that for whatever reason that COVID virus kind of went to sleep and then it wakes up again? Or is this a new infection? I had a patient that actually was shown on TV that had 3 negative tests after we got him out of the hospital. 3 negative tests, did fantastic for 2 months, and then got COVID again. And yes, you can get, from my standpoint, I tell people, the reason why you need to know these things is because you want to make sure that that you don't drop your guard. You don't, say, hey, because I had it, it's not going to happen to me again. You have to be equally careful whether you have it or you don't have it. And the way I put it so that people understand is, in Houston, there are only 2 kinds of patients: those who have COVID and those who are going to get COVID. The way this pandemic is working, sooner or later, we're all gonna get infected with the virus. 2 important things to understand. 1, you don't want everybody to get infected at the same time, which is what just happened to us a couple of weeks ago, where all hell broke loose in all the hospitals, because you don't want to overwhelm the healthcare system. And second, you want to get the infection, but you want to get the infection, late. That means an infection that is probably not going to be as aggressive the infections that we have. Like, we've all had flu at some point in time. I mean, you don't die from flu, or everybody dies from flu, like, we're seeing now. So It has to be a process. And that's why people have to wear their masks.
Okay.
Yeah.
Oh, thank you. Thank you so much for that information. Now, Constance Jones, my colleague, will have some more questions for you, Doctor.
Okay.
Absolutely.
Thank you, Dr. Baran. Wow, you are really educating us, giving us some great information. So my question is a twofold. One, how close are we to making a vaccine, or if any? And two, is the coronavirus expected to peak any higher than what it is right now?
Okay, answer to question number one. Did you see the smile?
Yes,
That was not a smile to tell you, hey, we have a vaccine.
I know.
That is a smile to tell you, you can hope whatever you want, but it ain't gonna happen.
Okay.
Now, let me tell you why.
Uh-huh.
Even if I had a vaccine today, okay, that is fantastic, that has gone through all the testing and has been the best vaccine in the world. For a vaccine to work, you need to inoculate a minimum of 60% of the population.
Oh,
But not just in the US, it has to be all over the world. You are talking about 5 billion doses that need to be produced. Okay, now you and me agree that, there is some Chinese company that's gonna make those 5 billion doses right away, and poof, I have it here, right for you. Now you have those 5 billion doses that you have to distribute around the world. That's another hassle. But the worst part of it, the one that really drives me insane, is my primary concern. You have the vaccine has been distributed, you gave them to the doctors. Now convince people to get the damn vaccine, because that's what happens to me every day. Every year when I tell my patients, hey, I need you to get a flu vaccine, people don't get it. I mean, even my own kids don't get the flu vaccine. You think that people are gonna get the corona? Not only that, we don't even know how many doses you need for that vaccine in order to be effective. Is it a single dose? Is it gonna have to be 3-4 doses? So the way I look at it is, don't expect a vaccine to fix the problem.
right.
The problem is very easily fixed. Keep your safe distance, wear your mask, wash your hands. Educate, educate, educate. We cannot be, closing and opening the state like if it's a yo-yo without education, which is what happened to us. I mean, we went ahead, we opened on May 1st the state, and people went like crazy to the beach, to clubs, to restaurants. I mean, people went crazy. We needed to do a very aggressive educational program to make sure that people understand those simple steps: keeping your distance, wearing your mask, and washing your hands. So that's question number one. Question number two was whether or not I expect a peak. If you look at the pandemic of 1918, when the Spanish flu hit the United States of America and the rest of the world for that matter, it followed a very similar pattern to the one that we had. We had a little wave that started sometime around March, April, and finished about late July. And then there was a second peak, and that peak started right around late October, early November. And it was a huge peak. It actually killed 10 times more people than the first peak. So what I'm telling you is that if we don't do things right, we're gonna have more than 1 million people dead by the end of the year. Because what you have there is a combination of coronavirus plus the flu, because it's around the same season, so all hell breaks loose. I mean, you're gonna have the healthcare systems are gonna be so overwhelmed that we're gonna lose people, and I'm gonna have to make decisions that are gonna be very difficult, as to who gets care and who doesn't get care.
That is excellent. I am loving this information because it is so many different things that you hear. You don't know how to decipher what is true, and I mean, this is great information. So that brings me to my next question, since we were talking about, is there a vaccine? So the next question is, are the anti-malaria drugs safe and effective drugs for COVID-19? That's a question that's been thrown out there a lot. Is it a yes or no? Is that true?
Well, the problem is not as simple as a yes or no.
Uh-huh.
COVID is the most politicized illness in the history of mankind. It's an illness that, unfortunately, in the United States is going to be a determinant as to who wins the election. Simple as that. Both sides are wrong. Both sides. There is no one person that I can tell you is right. Because you need to look at it from a scientific standpoint. I mean, there are some papers that say it works. There are some papers that say it doesn't work. There is some woman out there that believes in aliens that says that is, a panacea. I mean, these are things that, because the president uses it, then the Democratic Party says it doesn't work. Let me tell you as a doctor what I do. First of all, I am completely apolitical at the present time. Okay, I have no party. Not on the right, not on the left. I'm right in the middle because I'm a doctor. I use hydroxychloroquine for my patients in the hospital setting. Every patient that I admit to the hospital goes on hydroxychloroquine. But every patient I admit to the hospital has a heart monitor, so I know what goes on with their hearts. I check their liver function. I just check, all the things. The problem of telling people take anti-malarial medications out there is probably not a good idea because you don't know what their background is. I do understand that in Africa, we use a lot of anti-malarial medications on a regular basis. And even, some of us that have had the opportunity to go to Africa, I mean, we take the anti-malarial medications without even having an EKG or anything about the heart. But that's not what people are doing. People think that these anti-malarial medications, you can just take them like if they are gummy bears. And they take one and they say, I'm not going to get, there is no data that the anti-malarial medications prevent the infection. No data whatsoever. And the data that we have that it makes a difference in the outcome of patients is for inpatients that are closely supervised. So my recommendation would be don't use the anti-malarial medications unless you are in a hospital and I'm taking care of you. Simple as that.
Excellent, excellent. So we are seeing a lot of the contact tracing. So I want your input on that and how that relates to the public itself. And how does that actually, do you see that as something being really efficient as far as being to actually tracing it? First, can you define what that is? And then let me know what your thoughts on that actually working. Is that something that will actually capture true numbers and true data?
Okay, so first of all, you should know that when we do modeling to find out how many people you can infect if you are actively infectious, one person can infect 52 persons per hour.
Wow.
52 persons per hour. So now, go back to what I told you earlier, that 48% of people are asymptomatic of the ones that are COVID positive. I mean, you can be killing people up and down without even knowing about it. So for that reason, we have contact tracing. The problem that we currently have is that, the cow is out of the barn. There are way too many people out there for us to be able to do appropriate contact tracing. If you tell me that, we started to do the contact tracing in March of this year, things will be better. But right now, you are talking about a lot of people, thousands and more thousands and more thousands. And what you do with the contact tracing is you say, hey, where have you been? You identify a map, you start calling every person that this person has been in contact with. I mean, if you're talking about somebody, let's say, that goes to the supermarket and, saw 3 cashiers and at what time did he go in? It's very difficult. To me, at this point in time, it's absolutely worthless. Now, if we were in Korea, the people in Korea were fantastic. So you would go in and you would get your nasal swab. So they would do your test, and right there they would put an app on your phone. The app would send you a message if you were positive or negative. If you were positive, that app traced the places that you went to so that they could go and do the tracing over there. Unfortunately, we have not evolved into doing that in this country.
Wow, wow. Thank you so much. I'm going to actually pass it over to my colleague Ty, and she's going to be asking State Rep and Board Trustee Addie some different questions as it ties in with the COVID-19 and as it relates to the students and going back to school. And if you can stay on and maybe help chime in along with them, that would be great. But we so appreciate your patience and being willing to log back in. Thank you so much. Ty, you can take it over.
Okay. Thank you so much. Thank you, Dr. Joseph Baran. We're definitely informed about this information that you're giving us. And for schools, you know, school is about to start back. And is Addie on?
Yes.
Okay.
Yeah.
Okay. Hi, Addie.
Hi, how are you?
I'm good. So the question we have, what are the guidelines for nurses to provide care for students who may potentially be carrying the virus?
For
Or would
nurses?
you know that? Would you know that?
I don't think I would know that per se. Right now, we are starting school online. And so all of our students, especially in Fort Benning ISD, they will be at home. And so, but I haven't had to deal with that particular question. I know that our team of administrators are working with staff on when students actually come back to school. We will have monitors, health monitors, so that teachers won't have to be responsible for cleaning their rooms and those kind of things. We will have monitors just for that. We are working on how schools will have the traffic through schools so that we could limit the amount of contamination, cross-contamination in the schools. So those operational plans are still being developed. First is that Fort Benning ISD decided to go online first before we actually start bringing kids back to school. When we do bring kids back to school, it will be a gradual process. It's not going to be all of our students in at one time. We are going to have to ties the students that will come into our classrooms. And it really all depends on the current state of this pandemic as well. On what our next steps and decisions are going to be made. But right now, all of our students will start school online in Fort Benning ISD.
Okay, and then another question is, when you do open school back up, how will the educational, learning be provided, and how many kids will be able to be in a classroom? Will some kids have to stay at home and not get education and just do homeschooling? Like, how will that affect students going back to school if not too many people can be in one room?
I wouldn't say they're not getting education. I mean, so we are committed as a district to provide a very rigorous online learning environment. And so the kids that will end up in class at the school, we want to service our more special needs children first. Those of us who have children that need a little bit more services that cannot necessarily be provided at home, as well as those special classes that you really can't do that type of learning effectively at home. But we have a current online schedule for all our different grade levels that, matter of fact, today I posted it on my Facebook site, but it was communicated on July 20th via Fort Benning ISD board meeting. So we do have a plan in place for middle school, high school. They have a different learning environment where they're going to be on campus, online, for example, doing, I think it was like on a Monday and Tuesday, they alternate their four or five classes, different classes each day, and then Wednesday they do a combination of all 7 classes. But the administration has worked very hard to work through all the challenges. I mean, this is not an easy feat by no means. There is no, there is no right way to do this. I mean, I mentioned this earlier today online. what we can do is the best that we can do, and to service our kids. We are doing our best to make this a rigorous environment. It's not going to be the same environment that we had during the spring, because the spring we were responding to the pandemic, and now we are being proactive by planning accordingly so that we can have a different environment for our kids. And we want to make sure that all of our kids across the district and families are having the same type of learning environment. So it's not just, this particular school in this environment is having one set of learning experience versus another one in another environment. So we want to make sure that we are consistent with that throughout the school year while we're online.
Okay, awesome.
I hope that helps.
Yes. And State Rep Ron, could you chime in and give us your thoughts on that question as well?
Well, certainly. I want to commend Addie for her leadership. Fort Bend ISD has been a leader. Many schools have been reluctant to come forward with a plan, and Fort Bend ISD was one of the first ones to say that we're going to start out going virtual online, and they didn't wait to see what the temperature was and the pulse. They've done a lot of due diligence. So Addie, you're to be commended, Dr. Dupree and the staff at Fort Bend ISD and the board for making great, prudent decisions. As a parent of students in Fort Bend ISD, and as a state representative with public education being my top priority, the health and safety of our children is paramount. You can't put a price tag on our kids. They're precious. And my goal as a state representative is to make sure that as a state, we are still funding our schools so that our children can receive a high quality education. They're competing in a global economy. Do I prefer in classroom instruction? Absolutely. There is no substitute for in classroom hands-on instruction. But we know in this environment, as Dr. Verona stated, it's not safe right now. It is definitely not safe for children to go back right now. In terms of in the classroom, we know that until experts with science, like Dr. Verone say that it is, I don't want to put them at risk. There are over like 4.5 million students and over 700 in Texas and over 750,000 employees, teachers, custodians, teachers' aides working at the schools, and like Dr. Verone said, one person can infect 52 people within an hour. And so we know kids are kids. We tell them to wear their mask, and they may have them on for a little bit, or they may have them down over their mouth, but not covering their nose. And they're feeling fine, they're young, they're healthy, and they're transmitted. And then next thing they do is getting the teacher infected. Then next thing they know, they're getting grandma infected that has a compromised immune system. So we cannot afford that. And I'm gonna be very transparent. This Trump administration has played politics with this whole pandemic, and you had the education commissioner Betsy DeVos, really giving bad messages in terms of the safety of kids going back in classroom learning. And so I want to see the scientists. I want to see Dr. Fauci. I want to see the Dr. Verones. I want to see the medical experts. When they give the thumbs up, hey, it's safe for our kids to go back to school, that's when I want our kids going back to school, but not a moment too soon, because the worst thing is that we start sending them back to school, putting them in harm's way, and then we're going to end up having to shut it back down. Right. So online learning, I think that it can certainly work, but we're all going to have to work collaboratively together. I was talking to Dr. Dupree, and we're having a discussion tomorrow with the TLBC, but it's going to take a village. And this is really, when this message is out, this is what I want people to hear. We can't just depend on the teachers to teach virtually and the students to get everything they need, because there's a digital divide within many communities of color where, there's lower socioeconomic and some parents don't have internet access. I know we're working on that. Some parents are working and they don't have the ability or the education to really teach these things. So we are going to have to be villagers, churches and community leaders, elders are going to have to step in and really help fill in the gap to help these children through this transition. That's the only way we're going to close the gap that you're going to see between some of the inner city schools and the kids of color and the affluent kids. There's going to be a bigger, steeper learning curve. And that's what we're going to have to work. It's going to take us all working together collaboratively to help fill the void for this virtual learning. But that's really what we're left with right now. It's either virtual learning or no learning at all, because we can't go back in person right now.
Right.
Add to that, Ms. Jones?
Mm-hmm. Yes.
Okay.
Okay, yeah, both of y'all Jones. So just like State Representative Ron Reynolds stated that there is a digital divide. Even prior to the pandemic, there was a divide, and that was really clear and apparent, especially when I joined the board in 2015. There are some parents, because of their economics, they're able to hire tutors, homeschool teachers, and supplement during this period. And to be honest with you, that was happening even prior to the pandemic. When you see a lot of schools that their numbers are higher, it's not because some of the schools are having bad teachers, or we're not putting as many resources to it. There's all kinds of things that play into that. But one of the fundamental things that play into the successful scoring is the supplemental work that parents are doing and can afford to do. Right. So now you think about kids, learning at home, that now they have to either some of them have to do it on their own because their parents are working outside of the home and cannot stay with them to guide them, to challenge them, to make sure that they're on track. I mean, there's some kids that are extremely studious and can do it on their own. I was that kid. But I'm gonna tell you right now, just a personal experience. I've got one right here in this house that if I'm not gonna be on his neck, and that's probably a bad analogy in this day, but if I'm not on him all the time, it's gonna be tough. It's gonna be really tough. And just to get him through the spring, I had to take vacation days. I had to say, hey guys, I'm out for the rest of the meeting because my son has chemistry. My son has this. How many of us parents are going to be able to do that over this next period? So it's going to be very difficult, and I'm not saying that's the bad choice, but it's because of safety we have to do that. And to Representative Ron Reynolds' point is that we have to, I'm going to get on my soapbox, we as a community have got to stop saying, well, what should we do, and start doing. We have to keep our community leaders accountable. We have to keep our groups accountable, keep our friend groups accountable. We can't just sit back on our laurels and say, them over there need to get their stuff together. They may not have the resources to get their stuff together. So the saying, you gotta always reach back. And so those of us who have the resources or have access to the resources, we have to come together and figure out how to do this. My Links chapter is actually donating some laptops, even though the district is providing laptops for those who need that, but we want to give away some laptops because the ones that the students are getting from the district are going to be borrowed laptops. But then we said, well, wait a minute, if we can give some laptops the kids can have, right, then they can use it for all kinds of different things and it can stay with them over the years, even after this pandemic. So, I mean, so I challenge those who are listening on this call today, what can you do to help our community and help, help us help our kids be successful this year? So think about it. I know we got some engineers, we've got doctors, we got all these people that have great talents. How can we figure out how to set up tutorial services for kids during the week? How can we get some monitoring during the week? How can we help reading during the week and volunteering to our kids? Matter of fact, in October, I'm going to put this plug right now, is that I normally, for my birthday, we have a readathon. We're going to go digital with the readathon this year, and it's going to be fantastic because we need, we're going to have volunteers just like yourselves who are going to come and read to students in the classroom from their homes. So there's no excuses of whether, you need to get up, you got to drive there. There's no traffic time. You ain't got to worry about all that, right? So these are the kind of opportunities that we have as a district, as a community to help our kids. So, sorry.
Oh,
thank you.
I'm here because I will talk.
Yes, thank you.
Thank you.
Kindred spirits.
Okay, so State Rep, I know that the next upcoming year is the legislative, and we know it is going to be jam-packed, powerful. But I must say that I am so proud of all the state reps that's pulling together. You guys are doing different things to ensure that, you stay on point as it relates to the different orders coming down from Governor Abbott and so forth. So I guess my next question would be, what is your plan from a legislative viewpoint for the next calendar year when you're in session? One, as it relates to the teacher protection and student testing, and then two, just proper funding, as Trustee Addie just mentioned about, the different communities or different families that may not have that available to them. How will the legislative folks come at it as far as implementing to make sure that it's fair across the board?
Well, I think that's an excellent question. Just today, signed off on a letter, and I was part of a group that is pushing back on the TA, Commissioner Morath, and the Attorney General from his opinion about schools not being funded if they close their doors because a health agency, let's say Dr. Verone said this school should not be open, and the schools don't open. The state just said today they won't be funded. I'm fighting against that. That's wrong, okay? But my priority is going to be to make sure that we have a robust education system for K through 12, pre-K through 12. I've been a strong proponent of full-day funding for pre-K. I'm a strong proponent of making sure that we fund wraparound services, especially in our vulnerable inner city communities, where communities of color, and it is typically socioeconomic, okay? It's not as much tied to race as it is to economics and socioeconomics. So I want to make sure that every single child has an access to have a level playing field with a high quality education, regardless of the neighborhood that they live in. And so that means that we need to put extra resources from the state in those lower socioeconomic communities, because we know they need additional resources. We need to close the digital divide, make sure there's no connectivity issues in this COVID era where we have to rely more on online learning. We need to make sure those districts have all of the resources that they need.
Yes.
We don't need to cut any funding. Last session, we fought so hard to finally get teachers a pay increase, to put more money back in the school district so that they can have smaller classes, 22-to-1 student to teacher ratio. That is one of the things I want to continue to make sure that we do, is to adequately fund our our schools by paying our teachers what they deserve, and we still don't do that. We're still not there yet.
Right.
We're going in the right direction. Also, making sure that we continue to have a curriculum that is not Eurocentric. And then what I mean by that is we know that unfortunately TEA has been very politicized, and in terms of the textbooks and the teaching that they're doing, I want to make sure that we during this social consciousness of the Black Lives Matter movement and the era of George Floyd, I want to make sure that we're more sensitive on race relations, and we're teaching, cultural sensitivity, that we're teaching about, diversity. We're teaching about things to help people deal with the demystifying, Blackness, and that, in other words, that all Blacks aren't evil, and the things that have been portrayed in the media. That starts with educating people,
Right.
okay? Not just doing Black History Month in February, but working that into the context of the curriculum. And so that's one of the things that I want to see. So there's a lot that we're going to have to do during this next legislative session. And you know what? The best way for us to be doing the right things, if we're listening to stakeholders like Addie, we're listening to parents, we're listening to teachers. What often happens is where we fall short in the legislature is if we just listen to lobbyists, we just listen to ourselves, and we don't listen to the subject matter experts. We don't listen to the people that are on the front line. And when it comes to testing, I want to waive all testing for STAR, all accountability. I want to waive that, because the last thing we need to be doing right now is putting extra pressure on teachers and students to teach to the test, okay? There's no correlation with student success, college readiness, and these end of course exams. All it does is put extra pressure on teachers to teach to the test. It takes away their flexibility to really teach, and it really puts an overemphasis on testing. I want to waive all of that, just like we waived it for the end of last year when this pandemic hits. I want to waive it for the 2020-21 school year. That's the last thing we need to be dealing with. This transition we're talking about we're talking about virtual learning. We dang sure need to cut that out. Cut out any conversation of STAR test, having it tied, graduation, having it tied to teacher success. That we need to cut it out, okay? And so that's one of the things that I'm going to be very firm about. We are pushing back on the governor. We're pushing back on the TA commissioner. And the more people are engaged and doing that, the more you're going to see. Like at first, let me just say this quickly. At first, the school districts didn't have really much flexibility in terms of when they opened the doors. We were giving them mandates that we were saying, hey, one size fits all. You got to open up your doors. But now, because of the public pressure, we're giving school districts like Fort Bend ISD, like Addie just described, more time to really come up with a plan on when they go back to in-person, okay? At first it was like, no, it's tied to funding. You don't go back to in-person. You don't have a choice. So we need to stay engaged. TEA, unfortunately, is a political agency. The governor appoints the commissioner. He appoints the head, and then the commissioners are elected. It is, unfortunately, they're playing a lot of politics with our students, and we don't. That's the last thing we need, is our students being used as pawns for political purposes. Just like the state opened up too soon when we, back on, when we opened the state back up on May the 1st, or I can't remember the date, when we opened back up, the scientists said, no, it's too soon. And you see what happened to Texas. You see what happened to Florida. What we were doing is we were trying to appease the Trump administration. They paraded Texas as the model. Now Texas and Florida and Arizona lead the country in the number of positive cases. It is going up exponentially when we were going in the downward direction. And so we're going to have to continue to speak truth to power. We're going to have to continue to use our voice to push back on these things that impact all of us. And that's what I'm going to do. I'm going to lend my voice to work with all of you, to work with Addie, to work with science, to make sure that we do things that are sound in the best interest of our teachers, our students, and all Texans.
That is excellent. Thank you so much. And yes, I am definitely a firm believer that legislation is going to play a very pivotal role on next year. Of course, there are many, many important topics that's going to need to be discussed, but I know that COVID is going to be right there at the front of it. So I do have a quick question for Dr. Varon, since he's still on. And by the way, I want to tell the ones that is actually tuned in, if you guys have any questions, please post your questions in the chat. We want to try to get to your questions if all possible. And Dr. Varon, my quick question is, what exactly is being done to make COVID-19 testing more available in the overall US? And in your opinion, do you think that we're doing enough as it relates to the different sites that's been put up, different constituents access to the actual testing? What is your thoughts on that?
My thoughts is that we screwed up, and we screwed up early. And when I say, the reason why I say that is because even though the number of 130,000 people sounds a lot, I mean, we live in a city of several million people.
Mm-hmm.
If you want to be able to isolate or prevent this from going up, you need to at least test 50 to 60% of the population. We are way behind. Nothing has been done. And you heard that the federal government is talking about pulling the funding for more testing. I mean, that is ridiculous. I mean, the only way by which we can control this, in addition to the social distancing and stuff that I said, is by knowing who has it. If you know who has the illness, you can isolate them and prevent more people from getting infected. But you know, nobody's funding it. I mean, I'll tell you, we were supposed to get money from the government for the testing that we're doing. And it is the owner of UMMC who's pretty much coughing up all the money for this testing. I mean, all this testing, all these months has been funded by UMMC. No government agency has given us a cent, not $1.
What?
Yes, and it's not just that. You know, we also, all inpatient work that we're doing, nobody has paid us anything. And it really gets to be frustrating. For example, as a healthcare provider, let's assume, you know, the government says, we are going to give you guys money, and it's very easy. You just have to go into a website, you enter the name of the patient, and that's it. So I go into the website, I enter the name of, let's say, somebody that is an illegal immigrant that is in the States. So I enter, you know, whatever name it is, then it tells me social security number. Well, these persons don't have a social security number, so you cannot put anything. It doesn't allow you to go to the payment page, which is the next one. And that's the real problem. So imagine that 80% of what we're seeing right now, 80% is uninsured. 80% of the patients that we have seen. I mean, this is truly altruistic efforts by UMC and those of us who are passionate about this on working with patients. That's one of the reasons why you don't see too many doctors wanting to see patients that are COVID positive, because a lot of them are, as it was already mentioned, you know, a lot of them are communities of color, usually people that are on the front line working, they don't have insurance, and nobody wants to care for them. You don't know what the big hospitals are doing. You don't know all these patients that are being, quote unquote, dumped into us because nobody wants to take them. It is,
wow, I mean, I am.
And you know, I'm watching Ron just doing like this because he knows that I'm telling the truth.
Yes. Oh my God.
This is a serious problem. As I told you, you know, I'm completely apolitical. I try not to be in politics.
Right.
It is ridiculous.
Yes, yes. Oh my God. I tell you, well, Dr. Varon, like I said, I know that I want to be respectful of everyone's time, and we could definitely, this is definitely another conversation that we would love to have you back and you know, on a different day when you're available, because we need to be educated. There is a lot of false narratives that's being painted, a lot of information that's not being, really told the right way from the experts like State Rep Ron Reynolds just mentioned. Until he hear it from people like Dr. Fauci, yourself, and all of the other qualified folks that can truly answer that. So yeah, most definitely. I have one more question and this is going to be both for State Rep and Trustee Addie. We would like to know, let's see here, let me go back. Do schools face greater legal liability from failing to provide an adequate education to students or from students getting sick from the virus? And if both of you can chime in on the, Addie, especially you being a trustee, and then State Rep.
I think, did you want me to go first? I was having some bandwidth problems.
Yeah,
You all
so
hear
you can
me?
go first.
Yes.
Okay. Yeah, I'm having a little bandwidth problem. So I believe the question that I heard was, does the school district face a harder, more of a liability for bringing kids into school from a safety perspective versus their ability to educate our kids? Is that kind of what your question is, Constance?
Yes, absolutely, yes.
So I don't know if I really thought about it from that perspective. I mean, well, I have in a sense of that's how we make the decisions. That's why we're trying to make sure that we have a very rigorous environment. So I want to make sure that we debunk this mechanism that because kids are going online, that they're not learning. So I want to start there. The kids will be learning, and we have mechanisms in place to ensure to ensure that we're keeping the pulse on our children. The classrooms now will be face to face in a Zoom session or session like this, where the accountability is there, where students have to be in the classroom. So there's a lot of things that we as Fort Bend are putting in place so that we minimize the impact to our students' education. So I want to make sure I say that first. It's not that kids will not be getting educated. So that's first. So in my mind, safety is first. Safety is the ultimate question and challenge for us, and that's why we chose to do what we're doing. And so given us this first 4 weeks to kind of see how things are going, see what's trending in our environment. I mean, if you remember, I think Ron alluded to this earlier. Our governor, based on what was initially stated, we would not open up certain places until we saw a trend going downward. We did not even take our own advice, right, as a state, right? Went ahead because of political reasons and economic reasons, went ahead and opened up the floodgates. Right. And so here we are today. So it's almost like, how do you reel this back? And then you put the school, which is the biggest economic entity, how do we put that into play through all this, I call it a nightmare, this nightmare that we're having. It's very difficult, and there is no totally right answer. There's not a perfect blueprint or plan for this, but for me, it's definitely the safety. I'm more concerned about safety. So I don't know what the school district's answer will be there, the administrative or even the politically correct answer to that, but I'm just telling you what my answer is. Okay, and Ron can provide a more legal perspective.
Well, Addie, I think you kind of summed it up, but schools they have certain governmental immunities. That means that they are somewhat protected and shielded from legal liability. Okay, and so whether the private sector, if UMMC were Dr. Verone and their employees, they would have more exposure. Okay, and also you might hear the Congress talking about in this round of the second round of stimulus. One of the things that they're trying to do is give protections to corporations and to businesses from being able to be sued personally for COVID-related type of matters. So I think the schools probably won't have much legal liability from that standpoint. But the most important thing is that we realize that the state has a responsibility by our Constitution, the only to educate our children. But we unfortunately are in a situation where, as Addie just mentioned, and as Dr. Verone clearly knows, is that right now decisions are being made that aren't sound. And when I say sound, medically sound, there's no science. And so that's the struggle that I have is, we can't as elected officials ignore science to the detriment of our students. We have to basically make sure that we put public health first. Public health is first and foremost before we talk about anything else. Now, educating our children is certainly second to their safety. We can't educate our kids and then allow them to get sick and possibly terminally ill. This disease, COVID-19 can carry a death sentence. And we have demystified the fact that young people can get sick and get terminally ill, because as Dr. Verone can certainly testify, young people are dying from this disease. Okay, and so we can't be ignorant. And so we don't want to put our students in that position where they're getting sick and they're getting others sick. And so I want to make sure that as a state, we continue to be prudent and make decisions based upon science. And then finally, too, when Dr. Verone was talking about the fact that, many 80% or so don't have health care, Texas leads the nation in the number of uninsured. We're number one. We're dead last. And so that means that most people, that especially people of color, poor people, they don't, because we don't have Medicaid expansion in Texas. That's a political thing.
Yeah.
So there's no excuse. So what happens? People don't get that preventive care. They don't get the medical treatment. They don't get the doctors wanting to see them because there's no insurance. There's no health care. And so that's a problem. And so we need to fix that. We need to fix the fact that we lead the nation in the number of uninsured, and that is something that the state legislature can fix. But unfortunately, that's politics. The Texas Medical Association, the Texas Hospital Association, the Chambers of Commerce, they're all saying, please, we need Medicaid expansion. And unfortunately, I can say this, Dr. Verone cannot, but the far right, they're playing politics with people's lives. They're not allowing us to get the health care that Texans deserve because it's called Obamacare.
Right.
The Affordable Care Act is the Obamacare. They don't want that. But guess what? When there's no plan to replace it, okay?
Right.
And so, guys, I'm just going to be real with you guys. We're going to have to be engaged. We're going to have to hold people accountable to do what's best for Texans, regardless of race, regardless of socioeconomic. Healthcare is something that should be something that everyone has the right to. It shouldn't be just for the well-off or the well-to-do, okay? It should be a human rights issue when you talk about healthcare, when you talk about education. Those things should be fundamental, regardless of whether you're an immigrant or not. We can't decide if you're an immigrant you get health care, you get a chance to live, or you get an education. That's not the way we do it in America.
Mhm.
And so we have to make sure that everybody's protected. And that's what I want to, emphasize, is that everyone needs to be engaged, hold their elected officials accountable, make these things a priority, and that's the way we'll get them done. But until then, we're going to continue to lag
Mhm.
behind in healthcare. We're going to continue to lag behind in education, and we're going to,
Yeah.
as a state, we won't be as competitive with other states if we allow some of this foolishness to continue to happen.
Mhm. Thank you, State Rep, and I know you're working hard, and for being is leading the way, and they're doing great things. Shout out and salute to Trustee Addie, along with the other Fort Bend trustee board. They're doing a great job. I have one last question for Dr. Baran, and then Ty will ask State Rep you and Board Trustee Addie one last question, and then we'll wrap it up. I think I'm going to check the chat, but my last question for Dr. Baran is, how are the hospitals managing the major surges of COVID-19?
Well, I cannot tell you how the other hospitals are doing it. I can tell you how we are doing it. And basically, what my partner Saed has been doing is just helping us expand economically, adding beds and more beds and more beds and more beds. But you need to understand that it's not a matter of having a lot of beds. It's also a matter of having the staff that you need. So, we went through a lot of different things. More recently, the U.S. Army has come into our hospital. We have actually given them an entire ward for them where they have up to 50 beds so they can take some of the overflow that we're getting. They don't deal with our patients, they have their own patients. So what happens is, let's say, CETRAC calls and says, there are 10 patients waiting for beds elsewhere. We said, we'll take them. I take some in my unit, they take some in their unit, so we can alleviate all of these things. But in reality, we are not prepared for what's going to come in the fall. We are not prepared, and we need to be prepared. And that's why I have been so vocal, and so, I've been talking so much on the different media outlets, trying to get people to listen. We can put a stop to this nonsense if you get people to keep their safe distance, use the mask, and to wash your hands. As far as the schooling goes, which I didn't go into it, I have very strong feelings about schooling because I am very concerned, not about the kids. I understand that Ron is concerned about the kids. I'm not concerned about the kids because most kids will be okay. You know that young kids usually don't get too much in trouble. I'm talking about statistics, okay? But I do know that the kids are gonna go and see their parents. I do know that the kids are gonna go and see their grandparents. And I do know that those kids are gonna be transmitting that illness. There is a very nice study that was done in Korea where they looked at 60,000 people, of which 6,000 were positive, and they basically traced them. They really did a good tracing on them. And what they found is that if you are a kid under the age of 9, your chances of transmitting the illness are less than 50% of an adult. But if you are a kid between the ages of 9.5 and 18, you are as likely as an adult to transmit it. So I am very concerned about that, because if we open all the schools at the same time, if we start getting a lot of kids, there is no way in hell you can keep a kid still in their class. They are going to be interacting with other kids, which is, it's natural. But at the same time, right now, I don't think that we're in a state, I don't care what anybody else says that, we have hundreds of beds available. That's nonsense. It's how many bodies do you have to take care of those beds? And that is my concern. We open schools, the schools start getting really strong, and then, parents of the kids are getting sick. The grandparents of the kids are getting sick. And then we start getting into the early fall and we start having flu, and it is a prescription for a disaster. So when people ask me, what do I think we need to hold off on opening schools until we have a better control of what's going on. I mean, we're barely keeping up with what we have, and now we're asking for more trouble. And it's serious trouble. I have not had the opportunity to tell this to the face of our governor, but if I have the opportunity, I will tell him this. I will tell him that I'm seriously concerned about not endangering the children. I think that we're looking at the wrong angle. I'm talking about endangering anybody that the children are close to. You know, I have to throw in that because,
Yeah.
you know, it's like Houston, we have a problem. Yes, Houston, we have a huge problem.
Exactly, exactly. And again, Dr. Baran, you've been very kind and gracious with your time. I know that we had some difficulties. I appreciate you coming back and signing in. The conversation was very, very informative. That's why we collaborated these two together. Of course, our state rep on the legislative part, he's working hard. He's out there in the community, just connecting with the different organizations and making sure that real-time information is being disseminated. And then, of course, we have our trustee, Addie, that's doing a great job with the Fort Bend, that's leading the way with the the ISD. So this has been a great lineup. And again, Dr. Baran, just so you know, we will be reaching out to you again because, like I said, education is the key to keeping us informed and practicing safe distancing and doing what we need to do. So with that being said, I'm going to pass it over to Ty to close it out, and then we'll pass it over to Deborah. Thank you, guys.
Thank you. We have one last question. And this question is for State Rep. I know you answered it over in the chat, but so other parents can hear as well. How can parents help you with pushback to TEA and Governor Abbott?
Well, the main thing is for parents to understand the power of their voice. The people don't really understand a lot of times the power that they have. We're all elected officials in terms of the governor, the lieutenant governor, state representatives. And so we serve at the pleasure of our constituents. And when our constituents speak and we don't listen, then oftentimes we can be terminated from our jobs by being unelected, by having someone else take our position by defeating us. So people need to understand that they need to make their voices heard. And there's no real, there shouldn't be any trepidation with saying, hey, you work for me, I'm your constituent. Even if you didn't vote for the person, they represent you. You have an opportunity to make your voice heard, and you should. How should you do it? You should call the district office, okay? You should send a letter via email. You can, I encourage people to use social media as a powerful platform to get other people engaged. Another thing that is very effective when it's done right is petitions. Move On has organized petitions, and those have been very impactful when you can say 10,000 people have signed this petition, and you can do that stuff online, electronically. So that is the key, is to make your voices heard. We can't do much in-person stuff, but you can blow those phones up, you can send those emails, and you can make sure that you're utilizing your social media platform to build momentum about an issue and get other stakeholders engaged in the process. And then people take notice. And then the media starts to look at it. And then they run profiles on things. And then elected officials say, uh-oh, we better make sure that we address this issue. I'm so proud of the movement that you see addressing social injustice when it comes to policing. And you can see that has put that in front and center. These marches, these protests, the action that you're seeing is moving us to address systemic racism and police brutality and making reforms. There's no reason why we can't have the same type of movement within our education system. But it takes people working together of all races, all faiths, coming together with one message saying, we need to make this change. And that is the way it'll happen.
Yeah.
Okay. Thank you. Thank you for that. And I got another question that just came in. We're closing out after this question. Okay, so this is for both State Rep and Trustee Addie. What fund or provision can and will the state put in place for students not taught the content mastery moving forward?
Is Addie there? Or?
Addie?
Yes.
So it's not, so we're not, it's not gonna, it's not, once again, I'm gonna respond with, it's not about what content is not gonna be taught. We'll be teaching the content. We have a set schedule. They will have teeth that they will have to, teachers will have to still abide by. So maybe I'm not understanding the question. The content, it's not, the content will be taught. There is, we're still going to be delivering the same amount of minutes that, y'all can't see my fingers, quote, that the TA requires us to provide to our students. So all those measures are still in place. It's the delivery that is going to be different. It's just going to be online. So all those measures are still in place.
Okay.
And I would add this is that unless the commissioner waives things, all the accountability, everything is still there. So they still have to teach a certain curriculum that is TEA approved. They can always add to it, but there's minimum things that they have to teach in terms of concepts. And what I'm trying to do, and others are trying to do, is to get them to waive the standardized test that is associated with that. I think that is just too much right now with this online learning. I think we just need to focus on getting that well, allowing students to transition in that. That's going to be enough by itself. Then having to, on top of that, then worry about the inner course exams, the STAR, and all of that stuff. And so the curriculum, like Addie said, is still there, and all of that is governed by the TEA.
Okay, and I think it's meaning the child that is not able to learn online, like they don't have that ability to learn online. Basically.
Okay, I can do that because that's my child. You're speaking about my child. Somebody who wrote that. He has challenges working online, and I think I mentioned this earlier, where I had to take vacation time and days just so that I can get him through last spring. And I'm a parent just like everybody else, and there is no. This is not a perfect situation.
Right.
This is not, I want to just share that with everyone. Everyone has anxieties. And it's okay, because we are embarking on new territory that none of us have had to deal with before, right? And so, me personally, even as a board member, I put my board hat on, and then I have to make decisions, but then I have to put my parent hat on. And I tell you, it is daunting, even for me as a parent, to get my child through. So that's when I spoke earlier about who our first priority when we do open, all that is going to take in place, take into consideration, any type of special needs, any 504s, all those type of services will be take into consideration when we do actually move forward. Our special education department is working hard to provide services and support for our parents at home. So one thing about standard is that standard is defined by you or by us. If I have a standard that I must look a certain way, it's defined by me. So one of the things I've challenged us and challenged the district is, what is the standard look like during this time? And so even from a disciplinary standpoint as well, because now we have to change our code of conduct book to make sure that it takes into consideration this online learning. What I don't want it to be is extremely punitive to our students, especially for those who know we know have challenges and will have difficulties staying focused, and staying focused and just making sure that they do the work. And we're going to have measures in place to ensure that kids stay on track and get special help for those kids to get them on track. It's going to be everybody working together. There is no total playbook for this. Okay, it's kind of like being a parent. You can see all the things, read all the books you want to, but until you start raising your child, you have all these ideologies and of how you're going to raise your kid, and then little Johnny or little Jane comes in, and his or her personality is different than yours, and doesn't respond to things like you do. Guess what we have to do? We have to pivot as parents, right? So
Right.
we're all going to have to pivot during this time and work together and create communities of support as well. You don't have to do this by yourself. So, there's a lot of Facebook groups starting around for different schools, different classes. So I would encourage everyone to reach out and ask for the help. If you have a student that you're having difficulties with at home, getting them to stay focused and learning, please do not hesitate to share that with the teachers. The counselors are still there and available, okay? We can still have special ed and art meetings to support you during this time. So just because we're online, those services do not go away. We have mental health counselors. We still have our mental health program that is in full effect. Our crisis unit that's still in full effect. Those don't go away because we're online. Our online is just where we physically sit. It has nothing to do with the services that we are still going to maintain throughout the school year.
Okay. So if the parent can't afford to pay someone to help the child, then you have extended that to go into the home to help them or online.
So I don't know about if it's going to the home, but we are working with, you reach out to the school, and of course, like I said, they're going to be monitoring. So when your kid, based on the schedule, has to log on, just like we did today in the Zoom, and there will be Teacher Jones on the other end, and there will be all his 30 people or 25 people in the classroom. He or she has to be present. And so they will be taking attendance for those students. So there will be triggers in place for kids who are not responding to that. And so there will be interventions also available to those students. So we're not going to wait till the end of the 9 weeks to find out that Addie hasn't been going to class. There's going to be certain triggers throughout this process in order for us to start some interventions.
Okay. Thank you. That is some awesome information that all parents, will be able to hear once we put it out there. Thank everyone for being on the panel and informing us. I'm going to turn it over to our COO, Deborah, and she's going to close it out for the night.
Okay, my fine friends.
We have one more question.
Very much. Thank you so very much for being on this evening. Thank you for sharing. Thank you for participating.
Deborah.
This was very informative. This was real quality time and quality information, and we will disseminate. So best believe. We're just pleased.
Did I tell you I was Caribbean too? Did I tell y'all?
Yes,
You guys before, huh?
Yes.
Yeah, absolutely.
Yeah.
Thank you so much. Man, y'all just brought a wealth of information and knowledge to this group tonight. We had some issues we overcame, and that's what really everything's about.
Yes.
What you guys are doing for us in your position.
I think Dr. Baptiste had a question.
And that's what life's about. It's about fighting the good fight, right?
I don't think
so
she can hear.
That's what we are about here at the American Caribbean Chamber of Commerce. I want to thank Constance and Ty and all the speakers and the participants.
Yes.
And I want to invite you back again in 2 weeks. I want to encourage you to like our American Caribbean Chamber of Commerce Facebook, Instagram pages to keep updated on what we have going.
Yeah, and excuse me, really quick, Deborah, I hate to cut it off. Representative Juan Reynolds, there is a pending question that a couple of people has texted and they really want the answer to. So before we officially close out, I want to make sure I honor that. One of the question is, with the school year starting online and some parents having to stay at home, to help their children. Is the Family Care Act, FMLA, being extended for job protection for parents? And are there any other legislative act/bill being created to help the families? It's a couple of people. I didn't want us to end without them getting that answer to that question.
Absolutely, and the FMLA is certainly in place, and I don't know how broad it's going to be construed, but it is certainly. I think there. I don't want to say yes or no. Let me get clarification on it so that I can then make sure that we send that out, because I know that the FMLA has provisions in there for a person to take leave to care, but I don't know if it would extend automatically for every parent to be able to stay home to take care of their children. There are going to have to be some serious accommodations, and if there's not, we are going to have to amend the law so that that can happen, because otherwise you're going to have a situation where we're setting these students up for failure because they can't, at a certain age, they can't be unattended at home to where they have to do the in-person, at home learning. So I think that there will be provisions that will be made to accommodate those parents, to give them the ability to homeschool their students. And the question is going to have to be clarified, because obviously people's employment is at stake, and that question has to be answered legally, because if not, that person could be terminated for abandoning their job. FMLA provides protections that you can't terminate that person once they properly go through FMLA. So I don't want to answer that without getting a hard, a definitive answer. But it is a question that is going to come up, and I wish I had done the research before I got on this Zoom today. But I will get the answer to that, and I'll send it out, because parents certainly will need to know going forward that want to stay at home or don't have a choice to stay at home. That a lot of people are going to be put in that position. One of the things that didn't come up this evening is that Fort Bend ISD and some other school districts are making available in-person learning for first responders and essential workers teachers, where they have learning centers where students can go because the teacher has to go back, once the school starts, the teacher has to go back. Then they will have those learning centers for first responders, children of police and fire, EMS and healthcare workers. They are making that accommodations, because that is another thing that you're seeing. One of the dilemmas and challenges is to the virtual learning is what happens to parents that have to work. How are they going to be able to take care and get their kids educated when they can't be at home? So we're trying to make provisions for that. So I'll do my homework and get the answer, definitive answer for the FMLA.
Okay, thank you so much. We just we wanted to try to accommodate every question, and I believe that about wraps it up. Thank you so much, State Rep. I know we will be probably asking you to come on again, because this is definitely a topic that is going to be ongoing as long as the COVID-19 is here. Same thing with Dr. Baran. We definitely want to have him back on, because we want to stay in touch and make sure that we're getting real-time, accurate, concise information. So thank you again for always being so gracious with accepting the Chamber's invitation to come aboard. You're very knowledgeable. We appreciate it. You give us good info. And like I said, with that being said, Deborah, all done.
Well, Deborah, with her rosy, wonderful things, I'm saying thank y'all so much for all your patience, all your knowledge, and for sharing with us. And we will never cease to be grateful. So again, in closing, American Caribbean Chamber of Commerce, Sip and Chat. Topic tonight was Houston, we have a problem, COVID-19 back to school update, and we have been updated. And we can't wait to see you in 2 weeks. So thank you again. Please like our Facebook and Instagram. Good night.
Thank you. Good night, everybody. Thank you. Bye-bye.